Start. Welcome back guys. Now let's discuss about the vascular physiology. See, in vascular physiology, in the name itself, it's there. We are going to discuss about what? We are going to discuss about the vessels. Okay. We'll be discussing about different types of blood vessels like aorta, arteries, arterioles, capillaries, venules, veins. Okay, and the lymphatics. We'll see. So let's begin our topic with the aorta. Okay, we are going to begin our topic with the aorta. So regarding aorta, what are the important points that you should know for your exams? See, aorta is a blood vessel which has a maximum Wind-Kessel effect. Okay, that's a very important MCQ. Aorta is a blood vessel which has a maximum Wind-Kessel effect. Even other blood vessels have the Wind-Kessel effect, but aorta has the maximum Wind-Kessel effect. Now, you'll be having a doubt. So, what exactly is this Wind-Kessel effect means? Okay, see, Wind-Kessel effect means it's the elastic recoil nature of a blood vessel. So, when blood comes, see, imagine here is the left ventricle. When left ventricle contracts, okay, whenever left ventricle contracts, 70 ml of the blood, that's the stroke volume, is going to enter into the aorta. So, in order to accommodate this blood, the aorta is going to undergo stretching. So, after stretching, the aorta will recoil back, it will squeeze back so that it will push the blood forward. Okay, so that stretching and recoiling nature of a blood vessel is called as a Wind-Kessel effect. And Wind-Kessel effect is maximum for which blood vessel? It's the aorta. In recent exam, this question was asked something like which of the following blood vessel has least Wind-Kessel effect? Okay, least Wind-Kessel effect is seen with which blood vessel? The options were aorta, carotid artery, renal artery and radial artery. See, this Wind-Kessel effect, it is the property of major blood vessels. Okay, the Wind-Kessel effect, let me write it here. The Wind-Kessel effect, it's a property of major blood vessels. It's a property of elastic blood vessels. For example, you know, aorta is an elastic blood vessel, it will undergo elastic recoiling. The direct branches of aorta, carotid arteries are direct branches of aorta, they are the major blood vessels, so they will also undergo elastic recoiling. And renal artery is also a direct branch of abdominal aorta, so it also shows the Wind-Kessel effect. So, out of the given options, the radial artery, which is a minor artery, it has the least Wind-Kessel effect. Okay. So, which blood vessel has the maximum Wind-Kessel effect is therefore aorta. Okay. Next, after this, what else you should know? Aorta is the blood vessel where you have the maximum blood pressure. Okay. So, which blood vessel has maximum BP? Aorta has a maximum BP. So, now where do we see the minimum blood pressure? The minimum blood pressure is there with the vena cava and the maximum blood pressure is there with the aorta. Fine. Next, what else you should know? See, this aorta, what do you think? Is it having the maximum area or is it having less area when compared to the other blood vessels? What do you think? Usually students will think aorta is having maximum area because aorta is a big blood vessel, it's a major blood vessel. See, you are having one aorta, but you are having millions of capillaries. So, area wise, aorta is having less area or less cross-sectional area, because you look at this image, you are having one aorta. See, you are having one aorta, but you are having millions of capillaries. So, the cross-sectional area of this millions of capillaries together is more when compared to aortic area. So, which blood vessel is having maximum area? Maximum area is always for the capillaries and aorta is having less area. So, that is what I am showing here. See, in the area graph, see, this is the area. In the area graph, aorta is having very less area. Area is very less. Bottom, almost the line is bottom. But if you look at the capillaries are having maximum area. Okay. But look at the other graph. Here, this graph is talking about the velocity. Look at here, velocity of the blood flow means the speed with which the blood is moving. In aorta, look, there is maximum velocity. But in the capillaries, if you see, the velocity is going to be very less. So, from this, can I say, always the velocity is inversely proportional to cross-sectional area. The less the cross-sectional area, see, the less the cross-sectional area, more the velocity. More the cross-sectional area, less will be the velocity. So, from this, we can say the velocity is inversely proportional to our cross-sectional area. Done. So, let me write the same thing here. So, look at here guys, aorta is having the least cross-sectional area, so it is having the maximum velocity of the blood flow, and capillaries are having the maximum cross-sectional area, so the blood flow is going to have the least velocity. Okay. And as the blood is moving with so much velocity in the aorta, as the blood is going with so much velocity, there can be turbulence. Okay, so there is maximum turbulence seen in the aorta. Next, apart from this, what else you should know? Guys, I am asking you, what is the first blood vessel that emerges from the aorta? We all know aorta is going to look like this. Okay, here is the aorta, so let's say. Every student knows from the aorta there are these 3 blood vessels which are emerging. 3 blood vessels are there. I am not talking about them. There is one more blood vessel which is coming out of the aorta. Okay, what is this blood vessel which is the first branch of aorta? The first branch of the aorta. What is this blood vessel? So this is your coronary arteries. So coronaries are the first branch of the aorta. Okay. Next, what else they will ask you in your exam from the especially vascular physiology is, see, when do you think there will be coronary blood flow? Coronary blood flow happens mainly during, what does I mean by, see, whenever heart contracts, okay, whenever the heart contracts, it is going to pump the blood to the tissues. So during systole, so whenever heart is contracting, that is systole, all our organs are receiving the blood is going to be rushed into the blood vessels and going to the tissues, we know that. But wait, coronaries, they are having speciality. What is that? The coronary blood flow happens mainly during the time of diastole. Okay, means the heart is receiving the blood, heart itself is receiving the blood not during the systole but mainly during the diastole phase. Okay, so coronary blood flow, let me write it here. Coronary blood flow mainly seen during diastole. Okay, not during the systole but during the diastole. You might be thinking, what is the reason? Okay, why the blood is going into the coronaries during the diastolic phase? Imagine these are the coronary arteries. Okay, these are the blood vessels which are coming out the coronary arteries. Now, where these coronary arteries are going? The coronary arteries are going into the heart. Okay, they are going to the muscle of the heart. Now tell me, during systole, whenever the heart is contracting, okay, see, whenever the heart is contracting, what do you think will happen to these blood vessels, to these coronary arteries? They are going to be squeezed. Okay, so during systole, the coronary blood vessels are going to be squeezed. There is going to be so much pressure in these blood vessels because they are getting squeezed. Okay, so do you think blood can pass into these coronaries easily during the systole? No, because the blood vessels are getting compressed. Okay, compressed. So the blood flow cannot happen easily. But during diastole, what will happen when the heart is relaxing? The coronary blood vessels will dilate. Whenever the coronary blood vessels are getting dilated, so more blood will go. So always remember, coronary blood flow is mainly seen during the phase of diastole. It can happen during systole also. But mainly happens during diastole. Okay, that's the one point which I want you to know. Next, apart from that, what else you should know? See, in your aorta, okay, some important points are there which are important for your exams. There are diseases where your aorta will be affected. Okay, for example, let's say the patient is having tertiary syphilis. A person is suffering with syphilis condition. You know, syphilis is a sexually transmitted disease because of the treponema pallidum, a spirochete, okay, which you can see on dark field microscopy. Okay, VDRL test is there. Okay, let's say the patient is having syphilis, he is going to die for sure. Okay, he will die at one point of time. But once he is dead, on autopsy, what you can find is his aorta is going to look like a tree bark. So this is the keyword for your exams. Tree barking appearance of the aorta is seen in which condition? The tree barking appearance of the aorta. Okay, I am not talking about the reason why there is tree barking appearance. That is because of the obliterative endarteritis. I am only talking here, the tree barking appearance of aorta is seen in which condition? Tertiary syphilis. Because of which organism? Treponema pallidum. It's a spirochete. Can be seen under dark field microscopy. What is the test done for syphilis? VDRL test. Okay. Next, there is a patient with a Marfan syndrome. Let's write patient having Marfan syndrome. See, in this patient with Marfan syndrome, in recently asked MCQ, Marfan syndrome, what is the inheritance pattern? Autosomal dominant disorder, Marfan syndrome. Marfan, fun stands for F, Marfan, fibrillin 1 gene defect. Okay, FBN1, fibrillin 1 gene defect, Marfan syndrome, connective tissue disorder. Okay, these patients will also die. Because of what? Because of aorta related problem. What is the most common cause of death in Marfan syndrome? Aorta related problem. What is that aorta related problem? Aortic dissection. Okay, aortic dissection is the most common cause of death in a patient with the Marfan syndrome. Okay, next, Let's say there is a patient with the Turner syndrome. You know Turner female. Turner's is 45x0. Okay. Let me write here Turner syndrome. It is 45x0, that is monosomy X. Okay, one X chromosome is gone. Now in this female, okay, definitely Turner is a female. Now in this female, again 2 aorta related problems are going to be there. 2 aorta related problems will come. What are those 2 aorta related problems? One is bicuspid aortic valve. Aortic valve was supposed to be tricuspid. Okay, it's a semilunar valve. Semilunar valve. Aortic valve is a semilunar valve with the 3 cusps. But in a patient with the Turner syndrome, her aortic valve is going to have only 2 cusps. Okay, that can possess a risk for the aortic stenosis in the later stages of her life. Okay, but for now, what is the most common? Most common cardiac anomaly in a patient with a Turner syndrome, bicuspid aortic valve. But one more is also there. She will also have one more aorta related problem. Do you know what is that? That is coarctation of aorta. In Turner female, one more aorta related problem, that is coarctation of aorta can also be seen. Somehow students will remember this coarctation of aorta. Coarctation of aorta is seen with the Turner syndrome, but they will forget that's not the most common cardiac anomaly. The most common cardiac anomaly is always bicuspid aortic valve. Okay, so done with this. The important points about the aorta completed. One more important point is that it's more of pathology, but let me ask you regarding aorta. Same regarding aorta. What is the most common blood vessel in your body which is at the risk of atherosclerosis? Okay, the most common blood vessel to have the atherosclerosis is, you know, we are discussing about aorta, so definitely answer is aorta. Which aorta? Is it ascending aorta, thoracic aorta, abdominal aorta? Which aorta? It's abdominal aorta. So the most common site of atherosclerosis, let me write here, the most common site for atherosclerosis is abdominal aorta. Okay, and that's the most common site for the aneurysms also, aortic aneurysm. Okay, so the most common site for the atherosclerosis is abdominal aorta. Done. Next, now let me discuss about the arteriole. Okay, what is something very important about the arterioles is these arterioles, they are having the maximum smooth muscles out of all the blood vessels. Okay, out of all the blood vessels, which blood vessel has the maximum smooth vessels? Arteriole. So that's why these blood vessels can undergo vasoconstriction, severe vasoconstriction or dilation. So these blood vessels are called as resistance blood vessels. Okay, resistance blood vessels. Why they are resistance blood vessels? Because they will offer the resistance for the flow of blood. If the arterioles are constricted, it is very hard for the blood to flow. Okay, it's not easy for the blood to flow. So these blood vessels are called as resistance blood vessels. They show maximum vascular resistance. They determine the vascular resistance. Okay, so yes, that's why these are called as the resistance blood vessels. And you tell me, have I already taught you? The afterload is depend on the vascular resistance. So you tell me today, arterioles are constricted, what will happen? And arterioles are dilated, what will happen? Okay, see, when the arterioles are dilated, it is very easy for the heart to pump the blood. Okay, because the arterioles are dilated, there is no resistance, the heart can generate less pressure to pump the blood. So afterload is going to be very less. What is afterload? Afterload is the pressure required by the heart to pump, to push the blood. Now today, arterioles are dilated, the resistance is very less, so it is very easy for the heart to push the blood. It will generate less pressure to push the blood. So yes, whenever the arterioles are dilated, afterload is going to be less. Means afterload means the pressure required by the heart, the afterload is going to be less. Whenever the arterioles are constricted, afterload is going to be more. Okay, there is going to be more afterload. Okay, done. Next, now let's discuss about capillaries. Okay, see, capillaries are also called as exchange blood vessels. Okay, they are also called as exchange blood vessels because it helps in the exchange of important, like, you know, substances like important gases, carbon dioxide and oxygen, transport, nutrients, exchange. Okay, now what you should know regarding the capillaries. Guys, let me draw a diagram here. We all know from the aorta, arteries are going to come, from the arteries, arterioles, arterioles, capillaries are going to come, capillaries, venules, veins, vena cava, right? Now on this side, I am talking about an arteriole. Okay, imagine here is an arteriole. This is the arteriolar end. Here is the arteriole. Now, Tell me, arterioles are going to divide into what? Arterioles are going to divide into capillaries. Okay, this pink color ring is a capillary. Now, capillaries, they will fuse and they will form the venules. So, on the other side, I am showing you the venule. Okay, here is a venule side. So, this is the beginning of the capillary, let us say arterial end, and here is the venular end or the end of the capillary. Now, here are the tissues that I am showing. Okay, this area I am showing you the tissues. Okay, this is the area where tissues are present. Now, guys, here I want to talk about two important forces. Okay, they are called as the Starling's forces. Starling's forces. Now, what exactly are the Starling forces? So, let me tell you, there are two types of Starling forces. The first type of Starling force that I am talking here is, let us say, hydrostatic pressure. Okay. So, hydrostatic pressure. Now, I am asking, sir, hydrostatic pressure is like what kind of pressure, sir? It's like what type of force? Let me tell you. See, every time I used to say this. Imagine you are a married guy. Okay, imagine you are a married person. Now, you are living with two types of forces in your house. Okay, in your house there are two types of forces are there. One is your mom and one is your wife. Okay. See, what always your mom will do. See, mom will say you are a doctor, you are going in the early morning, you are coming back at night. Okay, your mom is always concerned about you. Okay, she always wants you to stay in your home. Okay, she says like you take some rest, you take some holidays, you sit in home, I will take care about you, I will cook for you. This is what your mom will say. So, your mom always tries to keep you in the home. But what your wife will say? Wife is also a force on you. What your wife will say? Wife will say, no holidays for you, no holidays, no rest for you. You go and work for me. Okay, you get me some nice iPhone 16 Pro Max, you get me a Gucci bag, you get me that, you get me this. So, she is always trying to kick you out. Okay, your mom is always trying to hold you in. Okay, hold you inside the home, other is trying to kick you out. In the same way, in our blood vessels also, two types of forces are there. One is called as a hydrostatic pressure. That is because of plasma molecules. Okay, that's because of the plasma molecules, hydrostatic pressure. And other is the oncotic pressure. Okay, other is the oncotic pressure. So, these are the two forces in our blood vessels also, two forces are there. One is this hydrostatic pressure. Look, hydrostatic pressure, it is always helps in moving the fluid out of the blood vessel. Okay, like a wife, it is always trying to kick you out. It's this hydrostatic pressure always trying to kick the plasma out of the blood vessel. Okay, so that's why I am showing the direction like this, hydrostatic pressure. But what about this oncotic pressure? Oncotic pressure is always like mom, sir. Oncotic pressure, what it is trying to do? Oncotic pressure, it is trying to hold the plasma in. Okay, it's like a mom. So, one is trying to kick the fluids out of the blood vessel, other force is trying to hold the plasma within the blood vessel. Okay, these are the two types of forces. Now, I am asking you, see, when you married, okay, when you got married, so tell me, you are having two types of forces acting on you. One is your mom, another is your wife. Which force do you think is giving you more pressure? Whom do you think is giving more pressure to you? Is it the mom force? Is it the wife force? It's always the wife force giving a lot of pressure to you. Okay, so in our blood vessel also, who is wife? It is the hydrostatic pressure. Hydrostatic pressure trying to kick you out. So, in the beginning of the capillary, look, in the beginning, the starting of the capillary, it is the hydrostatic pressure which is greater than oncotic pressure. Okay, P stands for hydrostatic pressure. Hydrostatic pressure is always greater than the oncotic pressure. So, tell me what will happen? If the wife force is more, automatically fluids will start to come out of the blood vessel. Okay, the fluid is trying to, the plasma is trying to come out of the blood vessel, and where this fluid is going? The fluid is going to the tissues. It is bringing the oxygen to the tissues. It is bringing the nutrients to the tissues. It is bringing the glucose to the tissues. It is bringing the hormones to the tissues. So, yes, this is good. So, always remember, in the beginning of the capillary, hydrostatic pressure is always greater than oncotic pressure. So, fluid moves out of the capillary. Okay, but tell me, after few days, what will happen? In the beginning, it's the wife giving you the pressure. Okay, so after some days, what will happen? Your mom is watching you silently. Okay, so your mom will say after few days, okay, you became a big boy. Now you are you are no longer a mom's boy, you are a wife's boy. Okay, you will only listen to her. You are not going to care about me. Okay, she is going to start her drama. Okay, so after few days, her pressure will increase. Okay, so at the end of the capillary, it's the oncotic pressure is going to become greater than hydrostatic pressure. The oncotic pressure is now going to be dominant. But students, I forgot to mention this oncotic pressure is due to, okay, oncotic pressure is there. Oncotic pressure is due to which molecules? Albumin. Okay, oncotic pressure is always because of albumin. Okay, so now what exactly happened? See, all the fluid came out. Okay, the fluid is coming out. As the fluid is coming out, what will happen to the albumin molecules here? The albumin molecules is going to get concentrated. So now there is more albumin concentration, fluid is not there, plasma is not there. So what will happen? The oncotic pressure is going to be more when compared to hydrostatic pressure. So now tell me what will happen? Sir, oncotic pressure is more. Oncotic pressure will try to absorb the water, it will try to hold the water. So because of this high oncotic pressure, whatever the fluid which has gone out, it will again come back. This oncotic pressure is going to reabsorb the water. Oncotic pressure is always trying to pull the water in, it's trying to hold the water in. So what I am trying to say, in the beginning of the capillary, fluids will shift outside. At the end of the capillary, fluids will go back due to the difference in the hydrostatic pressure and oncotic pressure. Hydrostatic pressure is always because of the plasma and oncotic pressure is always because of the albumin. Okay, so now let's write here. In the beginning of the capillary, what will happen? The hydrostatic pressure, I have told you, it's greater than the oncotic pressure. So fluid moves out. At the end of the capillary, hydrostatic pressure will become less than the oncotic pressure. Oncotic pressure is going to be more dominant. So fluid moves into the blood vessel. Okay, now what is the clinical link here? Let's say today, because of some reason, the oncotic pressure is decreased. Okay, I have told you oncotic pressure is because of the albumin. Okay, so oncotic pressure, look at here guys, oncotic pressure is not the osmotic, let me be specific, oncotic. Okay, oncotic, osmotic almost the same, it's a osmotic pressure because of albumin is called as the oncotic pressure. Even other proteins will have also the pressure is there, but the osmotic pressure because of the albumin is called as the oncotic pressure. Okay, anyway, oncotic pressure is mainly measured with albumin. So look at the clinical link. Imagine today my patient is having a liver cirrhosis because he is an alcoholic. So do you think he can produce albumin? No, he cannot produce the albumin. Or my patient is having a kidney failure. If my patient is having kidney failure, do you think he can reabsorb the albumin? No, he is not going to properly reabsorb the albumin. First of all, albumin is not filtered. Okay, because of the kidney problem, because of the damage to the glomerulus, the albumin is going to be filtered and albumin will be excreted out of the body. Okay, because there is some damage to the glomerulus, the albumin is getting filtered into the urine and getting excreted out of the urine. So he is losing the albumin out of the body. See, I have told you two things. Either the patient is not producing the albumin, maybe in liver cirrhosis, or maybe the patient is excreting the albumin because of the kidney failure. In both the conditions, albumin level decreases, oncotic pressure decreases. So now what will happen if the oncotic pressure is not there? Do you think the fluids will go back into the blood vessel? No. So whenever the oncotic pressure is not there, you cannot reabsorb the fluids. Or you can see here, see, whenever the oncotic pressure is very less, the hydrostatic pressure will be more, relatively speaking. Okay, so hydrostatic pressure will be more, so more fluid will come out because one is a favoring force, other is an opposing force. Whenever the oncotic pressure decreases, whenever the opposing forces decreases, more fluid will go out. Okay, so what I am trying to say, whenever your albumin level decreases, more and more fluid will come into the tissue. And do you think this fluid will ever go back? No, the fluid is not going back. So fluids will start to accumulate in the tissue, leading to edema. So my dear students, right here, so loss of albumin, maybe in a kidney failure patient, so loss of albumin in the urine will lead to decrease in the oncotic pressure. Whenever oncotic pressure decreases, so that is going to cause what? That is going to cause edema. Okay, that's what's going to cause the edema. So with this, what we have completed successfully, we have seen what are the two Starling forces. One is the hydrostatic pressure and oncotic pressure. Next step, Now, here itself, let me add a few more important concepts which are important for your exam. Let's say 100 ml fluid. Okay, this is just example. 100 ml plasma comes into the tissue. Okay, 100 ml comes into the tissue. And how much is going back? Let's say 90 ml is going back. 90 ml of the plasma is going back. So, how much is left over always in the tissue? Let's say here 10 ml fluid is left over in the tissue. So, one time if 10 ml is left over, next time extra 10 will add up, extra 10, extra 10. So, this 10 will become 100 easily. So, do you want any fluid to accumulate in the tissue, any extra fluid to accumulate in the tissue? No, definitely not. We do not want any fluid to accumulate in the tissue because that can lead to edema again. So, we need to remove this extra fluid also. We have to remove this extra fluid. So, to remove this extra fluid, there are specialized blood vessels present. So, this specialized blood vessel which I am showing here in the tissue, it is going to remove this leftover fluid. So, this blood vessel is called as lymphatic. Okay. So, these are the lymphatics. Now, you tell me what is the importance of lymphatics? Lymphatics are those blood vessels which are going to remove the leftover fluid in the tissues. Any leftover fluid in the tissue will be removed with the help of a blood vessel called as a lymphatic. So, now you tell me today time bad because of some reason. This lymphatic blood vessel is obstructed. Now, tell me whenever the lymphatic blood vessels are obstructed, do you think this leftover fluid is removed? No, the 10 ml is not removed. The 10 will become 20, 20 will become 200 within some time. So, lymphatic obstruction can also lead to edema, that is called as lymphedema. Okay, lymphatic obstruction can lead to lymphedema. So, that is what I am showing here. Students, you get here lymphatics. What lymphatics will do? Any fluid left in the tissues will be brought back into the veins via lymphatics. Okay, look at here. See, this is the level of the capillaries. These are your capillaries, let's say. In your capillaries, see, there are some specialized green color blood vessels also present. What are these specialized green color blood vessels, sir? These are all your lymphatics. They will remove the leftover fluid, and all this leftover fluid now it is called as a lymph. Now, where do you think this lymph is going? Sir, this lymph is going through the lymph nodes. Okay, for like checking any bacteria is there. Now, from the lymph nodes, again this leftover fluid, this lymph, it is coming back into the venous blood. It is coming back into the inferior vena cava. It is going to mix with the venous blood again. Okay. So, yes. So, any fluid left in the tissues will be brought back into the veins via the lymphatics. So, lymphatic obstruction can lead to what? Lymphatic obstruction can cause lymphedema. Where do you see this lymphatic obstruction? Lymphatic obstruction is seen in filariasis because of Wuchereria bancrofti, microfilarial larva. Okay, very important image based question, microfilarial larva. How to identify microfilarial larva? In the tip of the microfilarial larva, there won't be any nuclei. Okay, so in your FMG exam and the NEET PG exam, they will ask you to differentiate between Wuchereria bancrofti, the microfilarial larva, with the Brugia malai. Okay, in Brugia malai, there is going to be binucleate, two nucleus will be there in the tip of the larva, but in Wuchereria bancrofti, that is a microfilarial larva, there won't be any nuclei. Okay, that image based question is also very important, but that anyway, that will come in your microbiology. But let's come back. What is the treatment for this condition? The treatment for this condition is diethyl carbamazine. Diethyl carbamazine is the treatment that is used for the treatment of the filariasis. Is it treatable? No, it's not treatable. 100% cure is not possible. Now, in the recent exams, how the question was asked? They showed this image. Okay. Now, immediately when you are looking at this image, you know this is the elephantiasis or filariasis because of the microfilarial larva lymphatic obstruction. So, they showed this image and they have asked what is the blood vessel that is getting blocked? Is it the arterial disease? Is it the venous disease, or is it the lymphatic disease? It's a lymphatic obstruction. The lymphatic blood vessels got obstructed, so the fluid will start to accumulate in the tissues. This is a lymphatic obstruction because of the microfilarial larva obstructing the lymphatics. Okay. So, yes, it's a lymphatic disease. Treatment with diethyl carbamazine. Okay. So, with this lymphatics also completed. Now, let's discuss about veins. Regarding veins, see, veins are also called as a capacitance blood vessels. They have more capacity to hold the blood. Out of my blood volume, see, out of my blood, 55% of my blood, right now, 55% of the blood is present in which blood vessels? It is present in the veins. So, always remember, veins contain 55% of the blood volume. They are also called as what? They are also called as a capacitance blood vessels. And if you ever look at a vein, this is how a vein is going to look like. Veins are going to have a very thin wall. The wall is going to be very, very thin. Okay, the walls of the veins are very, very thin, and inside the wall, inside the vein, sorry, you are going to have the valves. These are the valves. Veins are always having the valves. Now, look at an artery. This is how the arteries are going to look like. If this is the artery, arterial wall is going to be very much thick. Arterial wall is very thick. You can never collapse the arteries. Arteries are very thick blood, like the wall is very thick. Okay. So what about the lumen diameter? The lumen diameter is very small. The lumen diameter is very small. But what about the veins? Veins are having a large diameter. The diameter is very large, and inside that they have the valves to prevent the backflow of the blood. Okay. So veins has a maximum diameter and they contain valves. These are the valvular blood vessels. And even lymphatics also, if you look at a lymphatic, even inside the lymphatics you can have the valves. Lymphatics also contains valves. Okay, done. Next step, let me discuss about what is this AV anastomosis, sir. Okay, AV anastomosis stands for the arteriovenous anastomosis. What is something normal in our body? Tell me. First there is aorta, artery, arteriole, okay, meta-arterioles, capillaries, venules, veins, vena cava. This is the normal organization. This is how the blood vessels are organized. But in some places in your body, see, in some places in your body, a artery directly going to fuse with a vein. Okay, artery is directly fusing with a vein. There is no capillary in between, no capillaries. So artery is directly fusing with a vein. This is physiological in certain places in your body. In certain places, this is okay. So such AV anastomosis is seen in which condition? In which places? AV anastomosis, it is seen in earlobes and fingertips. Okay, fingertips and earlobes, they contain this AV anastomosis. And what is the importance of this AV anastomosis? It helps in the thermoregulation. AV anastomosis, it helps in temperature regulation, thermoregulation, maintaining the body temperature. Okay. So with this, what we have completed? We have completed the important points about all the blood vessels regarding aorta, arterioles, capillaries, Starling forces. Okay, we have discussed about the lymphatics, lymphatic obstruction, clinical integration with the filariasis and veins. Okay. So with this, successfully we have done with the important points about the blood vessels. In the next video, we will be discussing about the Poiseuille-Huygens formula, that is the hemodynamics. Thank you.